Good afternoon. I'm delighted to have Duncan Baird, our budget director, to join us today. And just want to comment first on the election in terms of the initiated acts. People of Arkansas were in a yes mood yesterday and supported amendments 1, 2, 3, and 6. And of course, I'm delighted with the passage of Amendment 3, the economic development plan that will give more flexibility to our municipalities to engage in economic development. It gives us a clear path forward, and it really shows the Arkansas voters and how committed they are to the importance of economic development and job creation in this state. So I was very pleased with the passage of Amendment 3. Obviously, I'm grateful for Amendment 2 that was passed that makes it clear for future governors and myself that we can engage in a mobile society without losing the power of governor. That is important for our state as we engage in national competition for job creation. And then in terms of Amendment 6, which is not the yes vote I wanted, but we got it. Today I will be asking for approval from the appropriate legislative committees of $3 million of rainy day funds to front load and jumpstart the implementation process for Amendment 6. As you know, I had a news conference in which I articulated the cost that has to be front-loaded for the implementation of these rules, for putting the personnel in place. And because there's a very short window under the amendment for the adoption of rules, I did not want any delay to be caused because of lack of resources. And so this $3 million, which would be allocated toward the Department of Finance, the Department of Health, to start getting the personnel and resources needed to implement these rules will happen without delay. And so we will be proceeding with that today. With that, I'm happy to take any questions you might have.
So the income tax cut of $50 million, have you decided how that would be apportioned, higher end income, lower end income, or is that going to be negotiated with the legislature?
I expect to provide the details of my tax plan prior to the legislative session, but I did not want to do it in conjunction with the budget, so we allocated the amount. And certainly I'll engage in legislative discussions as to how to allocate that $50 million. And my highest priority will be the reduction of our income tax rates. But I recognize there are other emphasis on tax reductions that will be considered as I make the final recommendation.
Is this on top of the grocery tax cut?
Yes.
On top of it.
Yeah.
Okay. Is there going to be a income level that you're going to focus on?
Well, that remains to be seen and announced. The last time our focus was the middle income, and so obviously it's the low income and the high income that are next in line for the tax break. But this is something that I want to spend more time on and work with the legislature on, so I'm not announcing it today, the details of that, and we'll wait until closer to the session to make that announcement.
Your plan on GIF and on surplus, I just wanted to clarify, make sure I understand it. How does this work with the plan for tapping into surplus money for highways? Is that accounted for in what you detailed today, or is that not funded at this point?
No, that's really not related to this budget, even though it does reflect the tightness of the budget in terms of surplus money. Now, let's think about the highways for a second, that right now, the next time frame that's important is October of 2017. And so we've already allocated what was close to $50 million this October of 2016 for highways to meet their first commitment to match federal funds. The next one is 2017 in October. By then, we will be through this fiscal year, and right now, we are slightly behind projection. And so it doesn't look good right now. But we've got 6 more or 7 more months before the end of the fiscal year. We're hopeful and expectant that the revenue picture will increase and that we'll have a robust surplus that we can share with the Highway Department. Of course, the commitment is 25% of the surplus would go to highways, and so we'll see what that surplus is, but it's not dependent upon this budget. It's really dependent upon the economic growth and the robustness of our economy between now and the end of the fiscal year.
Governor, on medical marijuana again, you said the $3 million. Is there anything else that's kind of high on the to-do list?
Yes, we have to appoint a marijuana commission, and I'll be meeting with the House and Senate leadership because the Speaker and the President Pro Tem have appointments to make, and I want to get their thoughts on that as well as the implementation of this. And then, it's a challenge on the rules primarily because under our new regulatory process in Arkansas, we put notice out of our regulations, and then it has to go through legislative review. And so it's going to take us some time to develop some very complex regulations on a critically important topic, and to have them go through legislative review. It will be nigh unto impossible or very difficult to meet the deadlines that's in the amendment. So we have a lot of unknown questions and territory we're going through. As I've mentioned, the Obama administration gave almost a waiver for the states that are implementing these type of initiatives so that they don't fear federal enforcement powers because it still violates federal law. Will the Trump administration have a different approach? We don't have the new Attorney General yet. What will be their approach? And so much is unanswered in reference to these questions. The people have adopted this, so I want to lean forward for its implementation, but we want to move forward carefully and thoughtfully, and the time limits are very, very constrained.
Do you intend to, go forth or would there be some kind of element of trying to use whatever power you can to prevent this from occurring?
No, that's not the case. The people voted this in, and I intend to implement it according to the will of the people of Arkansas. But the people of Arkansas also expect me to do it right, to do it in a way that protects our children, to do it in a way that minimizes the problems that we have been very concerned about. That's what the regulations are about. And also to do it in a way that doesn't take away from education, that doesn't take away from our general revenues, which means we've got to assess additional fees for the licensing process. These are all unknowns, but that's what the Arkansas voter would expect of me, is to implement it, but to manage it and to protect the vital interest of our state.
This almost passed in 2012, and it's been passing in state after state. Is this a case where government leaders failed to read the pulse of the voters, and that now it's been forced upon them?
I look at it totally different than that. This is, it's like any other amendment. I don't consider the voters forcing it upon us. It's a debate of public policy. Elected leaders engaged in that debate and expressed their views. We did that, and the voters made their decision. I think it's an example of the states innovating in a risky area. And certainly the states are leading on this, but we're to the point that the federal government is going to have to readdress it. This does not call for a state-by-state solution. This calls for we're to the point that it calls for a national solution. And that means Congress is going to have to address it as well. I don't like the idea of implementing laws in Arkansas that violate federal law. That is a given. It is where we are, and that's not a good position to be in. Can you imagine any other arena in which I'm implementing laws that violate federal law under our supremacy clause? But that's where we are. And so I would like to see this readdressed at the federal level. Right now, it's not just Arkansas that's passed this initiative, but Florida has as well. And so you have multiple states now implementing this new regime. We're learning from them, but at some point, it's going to call for the federal government to readdress where they are.
Are you saying legalize it?
No. I'm saying address it.
How should the federal government address it?
How could they?
How should they, in your view?
I've got to give more thought to that. President Obama addressed it by simply issuing guidance that they're not going to be enforcing the Controlled Substances Act in reference to medical marijuana. They're not going to be enforcing the banking laws against financial institutions that do business with marijuana companies. And so they just gave a waiver. That's one approach. The other approach would be to actually to amend the federal regulations to specifically allow for states to utilize medical marijuana. I suppose the next way would be for the Federal Food and Drug Administration, the FDA, to expedite their review and to take charge of it. So, they could set up a medical marijuana regime through the FDA that then would be a national standard versus yielding to whatever state does and does it differently. That's all the speculation I'm going to do on what ought to be done at the federal level.
Okay, I have one more then very concrete question. What about, are you going to set up a set of guidelines for state agencies that deal with state employees who use medical marijuana?
Well, that's one of the issues that we can address. Right now, at the governor's office, we have a drug testing policy. And so we've got to look at that. My thought is that that's not going to be, there's still a great deal of discretion that's given to employers on this regard, and the fact that you've got a Department of Health that is issuing certificates for legitimate health needs for those that have a health need that need medical marijuana. So you've got some verification process for any exceptions, but we will have to readdress that from a government employer standpoint, adopt the guidelines, just like every other employer in Arkansas is going to have to take a second look at that.
And what does this do to the session coming up? I mean, this will you said earlier this is going to kind of dominate it if it passes.
Well, it's going to have to be managed. I suspect that I started to say that it would come up toward the end of the session, but we'd have to look at the timelines of the amendment as to how quickly it has to come up. But the fact is, this is going to take a lot of work to get it done right. You talk to the other governors who've had to implement it, and it is time-consuming, it's laborious, it is government trying to set rules in an environment that is historically prohibited in the terms of the use of marijuana, and how to protect the citizens of this state from misuse. So they've got to get it right, so we can't do it overnight. And so is it going to it's not going to upstage the session, but it will take a lot of time in the session in terms of reviewing the regulations, passing the legislation needed, and getting it right.
What is your,
Can you kind of give us your impression of the presidential race last night? What do you think America is saying in the election of Donald Trump?
you know, it's not unique with me, but the American people looked at where we are in the United States. They're frustrated. They want more accomplished in Washington. They want less gridlock in Washington. They want an outsider to come in there and change things. And they gambled or made their best judgment, I should say, that Donald Trump is the right one to lead a time of dramatic change in America and to change directions. That, to me, is what the American people are saying, and they're saying they do not care what the Hollywood crowd said. They do not care what the pundits have said for 6 months. They don't care what the Republican and Democrat leadership say. They express their view as to what is necessary for change. Now, the interesting thing to me, though, is that we did not see in the election yesterday Donald Trump in isolation. We saw Donald Trump as a Republican leader bringing votes all the way down the election cycle to legislative races, to county judge races, that the people who voted for Donald Trump voted Republican down the ticket. So that says they are trusting the Republican Party for change as well as Donald Trump for change. And so whether it's health care, or whether it is flexibility of the states, or whether it is lower taxes, that's the message to me the American public gave Donald Trump yesterday.
What would you consider to be the best possible scenario for health care under President Trump?
It's twofold. First of all, I expect immediate more flexibility to the states in the granting of waivers. Then secondly, you're going to have a longer legislative debate on the future of the Affordable Care Act, how it should be changed, replaced, and what it should be replaced with. And so 2 phases, and obviously the second one is the longer term one. In the first one, that's where we can go back in a new administration and say we were denied in the previous administration greater flexibility of the states in managing our Medicaid budget. We want to renew that request. Now that's going to take some time because you've got probably 30 other states going to be asking similar type waivers. And so it's going to take some time, but I expect fairly significant and dramatic changes in reference to healthcare policy and the relationship to the states in the future.
How do you think that would affect Arkansas Works?
It should not impact the immediate implementation of Arkansas Works, because we've got to implement Arkansas Works, one, when we get the waiver from this administration and by January 1. And so we're going to be implementing that. That's our legislative mandate but also what is necessary. So Arkansas Works is going to be implemented. What this will do longer term is it will give us more ability to accomplish reform. As you know, I asked for more reform, more authority in work requirements, more flexibility in managing the entire Medicaid budget. So I would expect the reform under Arkansas Work to be strengthened under a Trump administration, and more flexibility that I expect that they'll provide to the states, and we'll be asking for it.
So you don't expect this to lead to the 300,000 or so people on Arkansas Works to lose coverage?
No. Arkansas Works is the law of Arkansas and will be implemented January 1. And that covers the 300,000 that are on that expanded Medicaid program. Longer term, maybe 6 months in, 9 months in, at whatever point this administration gives us more flexibility, we might be able to strengthen those reform efforts. And as I said last year, I have to make judgments every day based upon what federal policy is. When federal policy changes, we'll make necessary adjustments here in Arkansas, and that future remains undetermined, but our immediate future is Arkansas Works.
I guess is your hope that there would still be some form of expanded coverage for those people, even if the Affordable Care Act is repealed? What's your hope?
I'm not going to speculate as to what should happen in the future based upon what Congress may or may not do with the Affordable Care Act. When I see the direction of it, I can engage in the debate and then I can respond to what is passed. I've always said that I have problems with the individual mandate and the employer mandate, which are sort of fundamental points with the Affordable Care Act. Let's see what direction Congress goes in the future, but right now we have coverage on the expanded hybrid program in Arkansas. We're going to continue that reform, and we'll see what the future holds.
What if you, I'm just kind of curious what you told Bart Hester about his $106 million tax cut proposal?
Well, I spoke not to him individually. Actually, I have met with a group of legislators, including Senator Hester, and they understand where we are in the budget. He pushes the envelope. I have to manage the entire budget for the state, and so we'll have a robust discussion, but he heard my presentation today, and he's a good team player, and I hope he'll understand when he looks at the whole budget as to we can do more, but if we're going to do more, you've got to have offsets with closing other tax loopholes or exemptions.
So were you surprised when I talked to you a couple weeks ago, it sounded like you weren't sure how the Trump effect was going to go down ballot? I mean, what happened? Was there a late surge that helped all these House Republicans?
Oh, it's just simple. I missed it. I thought there'd be a separation between the national Trump campaign and the national election and the state election. I didn't think it'd be a nationalized election, and I was wrong. Clearly, it was a national election, and it impacted state races. So the American people spoke, and I heard and listened, and I missed that.
Surprised if you won?
I am surprised he won. I thought that the election turned again when Director Comey made his most recent pronouncement, and I thought that shifted the momentum to Hillary and gaining confidence that you could see in the campaign, but it didn't change the American voter. So the prognosticators, I didn't anticipate a Trump victory last night. I would have done better a week before, but I thought the dynamics had changed. It had not changed.
Would you consider serving in a Trump administration?
No, I'm happy. How's that for clarity?
Were you saying that you thought that Trump was going to win a week ago?
I'm sorry? I thought that he had momentum and he had a good chance of winning, but I thought the Comey pronouncement of the investigation being closed again short-circuited that momentum. But I was wrong. His momentum continued.
Governor, the people that are nervous about, Trump president, what would you say to them?
Give it time. This is what's great about our country. Secretary Clinton did an incredible job of just being gracious and saying it's time for our country to come together. Mr. Trump gave the same signal that let's unify, and he reached out. We'll see how this works over the longer term, but that's what America is about, is having a hard-fought election, people coming together, and traditionally we have a good honeymoon. Let's hope that there is a honeymoon, and we hope that both sides reciprocate in that relationship to do something really good for America. That's my hope and that's my prayer.
Are there any specific waivers you'd ask for Arkansas lawyers under the Trump administration?
Well, first of all, I asked for a broad block grant type waiver from the Obama administration that was denied. So I can refocus that when the Trump administration is set up. I also asked for more stringent work requirements, and there were a few other items of reform that I asked for that was not granted under this administration that perhaps would be reviewed and looked at differently in a future administration. But it takes time. These things don't happen overnight with a confirmation, with a transition, and so Arkansas Works is going to be implemented on schedule with the waivers that we hope to be granted soon from the Obama administration.
Would you hope to get an assets test?
That's another one that would be on the table to consider, but the most important one would be the flexibility to manage the entire Medicaid budget. All right, thank you all very much.